Happy Motivational Monday. I hope everyone had a fantastic weekend. If you're joining me here in Canada, it is the long weekend. Today is Queen Victoria's birthday. So it is our May long weekend, and I've spent a little bit of time in the garden planting all kinds of green, nutrient dense foods. Today, nutrient dense foods might be of interest to you as well, but we're going to be talking about activity and some of my favorite tools to manage the symptoms associated with diabetes. So if you are pre-diabetic, diabetic, you've got a history of diabetes, today is all about that. I am not an expert at diabetes, but like many of you, we are to a degree because many of the people we live with or care about are managing this condition. So there's a lot of symptoms we're aware of, but sometimes we need a little bit of help or guidance as far as managing those symptoms and hopefully improving and lessening them over time. So I'm going to go over a little bit of info. Please tell me where you are from. Diabetes is a very big scope, and there's many people dealing with this condition or pre-diabetic. So if you do have any questions specific to your Lifepro tools, any wins, any losses, please share those with us. Today is all about sharing information. There is never one way to get from point A to B successfully. Hello, Kim from Campbell River. I think it's Kim. It says Facebook user, but I'm going to guess it's Kim because she's in Campbell River. But what I would like for you to share today is if you have had some successes with your tools, whatever those successes are, they're going to be different to everyone. Everyone's dealing with a different body, physically coming from a different place. So I want to show you a few tools today, not only to help manage your symptoms, but primarily talk about being active if you are dealing with diabetes, regardless of type. We're going to get into a little bit of science, a little bit of fact. If you are unaware, some of the preliminary signs, let's talk about signs first. If anyone is dealing with diabetes or you're concerned that you may be, having some symptoms surface, you may want to get things checked out by a doctor. I would absolutely suggest that. One of the top symptoms when I went to Dr. Google was urination, peeing a lot, often at night. You're very thirsty. You're struggling with losing weight, even though you're trying and the effort is there. You're very hungry all the time. Maybe not all the time, but you're very hungry. You have blurry vision, possibly. You have numbness and tingling of hands and feet, and that's one big area we're going to talk about today, which is neuropathy. In some extreme cases, atrophy. You're feeling very tired. Fatigue is a very common thing when you're dealing with diabetes, whether you're aware you have it or not. Having sores that maybe take a little bit longer to heal than traditionally, or they seem to just never go away. And having more infections than usual. That's a common sign of a few conditions, but certainly associated with diabetes. So if some of these things are registering with you and you're not taking such good care of yourself, there's a couple of ways you can develop diabetes, and then there's ways that perhaps it's just part of your biological makeup. There's three basic types. There's type 1 diabetes. It has a few symptoms of its own, things like nausea, vomiting, stomach pains. Type 1 diabetes symptoms can develop in just a few weeks or over months and can be very severe in many cases. Type 1 usually starts when you're a child, teenager or young adult, but it can happen at any age and it can develop. I've got lots of folks here. Hi, Eva from Michigan. She's not diabetic, but her husband is, and he's watching. All of this is good prevention too. Patricia, you are not diabetic, but you are insulinic. A lot of what we're talking about today, diabetes is a label, but there's a lot of symptoms associated with diabetes that you may be dealing with, associated with other conditions, or it's just something that you're dealing with. So thanks for bringing that up, Patricia. That is something we're going to talk about today as well. The other type of diabetes, very quickly, type 2 diabetes, which is probably a little bit more common, or if you know someone that has developed diabetes, that's typically the type that they get. Often takes several years to develop. Some people don't notice the symptoms at all. That doesn't affect your everyday life. Type 2 diabetes usually starts when you're an adult, though more and more commonly, children and teens are beginning to develop it. And this trainer's got an opinion as to maybe why that's occurring. And I think our lifestyle has a lot to do with that. But because symptoms are hard to spot, it's important to know the risk factors for type 2 diabetes. So some of those symptoms that I looked up, discussed in the beginning, we are very inactive as a society. We do less and less. We've got all these modern and electronic conveniences that make, our physical tasks a lot easier than they used to be. It used to be a lot of pain in the butt, fetching water from the river and, doing the manual tasks that we did, but it kept us fit. It kept the body, the machine, well oiled and exercised. There's a third type of diabetes, and many ladies I know have dealt with this, which of course is gestational diabetes, which is diabetes, of course, during pregnancy. Usually does not have any symptoms. If you're pregnant, your doctor should test you for this normally anyways, but it typically happens between 24 and 28 weeks of your pregnancy. And if needed, you can make changes to protect your health and the health of your baby, of course. So gestational, sometimes when the baby's taken some of those nutrients from mom, it depletes us of certain things and things get out of balance. But that is something that your GP or whoever is monitoring your progress will typically test you for it. It's something most of us have heard of or know someone that has dealt with. So just certain things to be cognizant of. Couple things about whole body vibration to start, and we're going to get over to some tools and some tips. What do I recommend that you use if you have some of Lifepro's tools, if you're dealing with issues now and you don't have any of these tools? There's a lot of ways that you can very simply be active and add a little bit of self-care to your routine to certainly reduce the severity of some of the symptoms that you may be dealing with, and perhaps progress in your health, lose some weight, get stronger. There's lots of ways you can improve this condition. It's certainly not a death sentence. I will ask, if you are here joining us with your diabetes questions or your success stories, we are talking about that today. And I want to start with my favorite tools, which of course starts with whole body vibration. So whole body vibration is one. Oh, I did not plug in my machine yet. How unprofessional of me. There's a few different tools that you can use. I'm so sorry. To be active. Some of these tools are dual purpose. What I love about many of Lifepro's tools is not only are they affordable in that they're accessible to you, but a lot of times, diabetes is one of those conditions that, as I said earlier, symptoms don't always present themselves right away. And a lot of times you don't realize you might be dealing with something until you're in more of a severe state. So don't pay attention to the signals when they arise. But certainly if you have some of these tools, an ounce of prevention goes a long way too. So we are going to go over a few basics of why and how whole body vibration can be effective if you're dealing with diabetes. The first thing I want you to consider, of course, like any of my medical related sessions, is who you are personally, regardless of whether it's diabetes or Parkinson's or cancer, whatever you might be dealing with currently. You are an individual. Your symptoms are individual to you, your tolerance. So there's lots of different ways that you can apply some of these tools, but in moderation, and be realistic for yourself and your goals as well. The biggest thing I say most people do with any of these tools, because they are so soothing, especially if you're dealing with pain, lack of energy, certain things, when these tools make you feel better, we tend to want to do them a little longer and we tend to overdo it. And if you're dealing with diabetes, I mentioned earlier, one of the big symptoms is fatigue. You're just too pooped out to do anything. And then if you do anything, you're really pooped out, and it's challenging to just manage your day-to-day if things have gotten extreme. So you'll notice that I'm seated in a chair, and I've done this in a number of my sessions. If you are dealing with diabetes and you have poor mobility, you're dealing with extreme neuropathy in the lower extremities, there's a lot of ways that you can improve the legs to help sustain you and support you as you progress into more weight-bearing activities. Just even walking. If you are doing moderate activity levels now, you can use your vibration plate to expedite recovery. One of the big things, and I'm going to have Lauren drop some links today, just some additional information, but I don't know if I'll be able to read this while I'm shaking, but There's a bazillion different studies out there on whole body vibration and diabetes, and you're never going to get a black and white, this is what you should do exactly for your conditions every time. There's too many variables when it comes to activity. But a moderate program of 3 to 4 times per week. I don't know that I'll get these dropped in order, but it showed a significant improvement in femoral artery blood flow. So one of the big issues you're dealing with diabetes is, especially if you're sitting and you're less active, you're starting to deal with swelling and neuropathy. There's circulation issues. There's lymphatic issues going on. And it becomes difficult to maybe be active, you know, if we're looking at the really extreme end of the scale. So just by placing your feet on your plate, hip width apart, if you are dealing with pain or you're a little bit scared, bring them a little bit closer to the center. Closer to the center reduces the amount of movement. Wider foot or hand placement increases intensity. And when you're dealing with neuropathy or pain, this machine is very, very effective at treating that in a very short period. But sometimes with neuropathy, there's other things going on. There could be bone spurs, there could be bruising, other things that you weren't aware of because your body's blocking those pain signals. That's why you get the neuropathy. So just do short, intermittent sessions to start. As you start regaining sensation, as you start losing swelling, progress with comfort. And that's in extreme situations. And one of the other things with the double-edged sword with neuropathy is it affects your gait, it affects your balance. So you're fearful, you don't want to fall, you don't want to trip up those stairs or down those stairs. So if you do have activity ahead of you, or you know that you're going to be, you know, on your legs and pushing yourself, just doing a minute or two before you head out the door, before you head to the garden, is going to expedite that blood flow and circulation. It's going to oxygenate the blood. It's going to give you energy versus deplete your energy. So if I had to pick one reason to use vibration machines for diabetes, is it gives you energy and does not deplete you from it. Very commonly when you're trying to be active, whatever that activity is with diabetes, it drains you, or you're drained already. So the last thing you want to do is be active. So just be cognizant. I'm noticing it's driving me crazy. Oh, I thought it was an Believer red belt poking in the corner, but it was my orange name badge. So, you know, as symptoms present themselves throughout the day, because the next question is going to be, well, how often can I use this for neuropathy? You can use this every hour if you like, if it's for a moment or two to treat symptoms. There's a very big difference when people ask me, how often can I use the machine for my diabetes? Well, it really depends on what you're doing on it, who you are physically as an individual, and how your symptoms of your diabetes are presenting themselves. So if you're prone to nausea and you tend to have a lot of issues with your stomach, when you're first starting out, I would go slow durations. I wouldn't stand on it and lock your legs and get a lot of movement to the head. Start seated. Get a feel for it. Let your body get used and accustomed to this new stimulus, and then progress. If you do feel really, really good and you've got a lot of sensation that's been restored and your energy is there, please, I caution you, don't overdo it. A lot of times when you're tired all the time and you're in aches and pains and this crazy little shaky machine makes you feel better, you want to go do things. So you want to paint the house, you want to do the grass, all those things that you just haven't had the energy or the fortitude to get to. So, you know, moderation after about, you know, couple 3 weeks, you'll feel a lot more comfortable doing other things in this environment. And as I said, use it as needed to treat symptoms. I'd rather you use it 4 or 5 times a day for a couple of, maybe up to 5 minutes starting out for symptoms versus a whole big old workout for 15-20 minutes starting out. Okay. So the second part, I rambled in the middle of what I was trying to talk about here. So I said there was a significant improvement in arterial blood flow. Whole body vibration improves leg blood flow in patients with type 2 diabetes. So, you know, there's a bazillion studies out there where you can see that it improved this, it improved that, but there needs to be more research. Then do more research. This is the drug-free alternative. If you've tried everything else and you haven't tried a whole body vibration machine, don't think of it as an exercise machine. Think of this as self-care. You can exercise, you can progress to that, but that's more about you, your discipline, your desire. I can't make you do anything, but I can make you move and feel better just with very basic use starting out. One of the other big things that's a huge advantage with using your plate, and I'm just doing this at about a mid-speed. I'm in oscillating mode. I do all my sessions in oscillating. All of Lifepro's models offer oscillating, and that is the primary movement. That is how we walk across the floor. Other models out there, other movements, anything that's moving your blood and your lymph is going to get you some benefit. But I prefer oscillating as you're sitting here. If you want more intensity, widen up your feet. If you want less, bring it a little bit closer. You're always in control based on how you're feeling day to day, especially if your symptoms vary from day to day. What else can I tell you? Interesting little fact here. Okay, so whole body vibration does not require much recovery time, as well as reduction in the feeling of fatigue after training. So I already knew that. But what this is also saying is it doesn't work much recovery time than traditional activities. So you're exercising at the gym or you're biking or whatever you may be doing. You need some downtime. You need some recovery. Maybe you use some tools now to do that. I'm going to get into some specific recovery tools here next. But the vibration plate can be fitness. It can be feel good, and it can be recovery. So you're not going to feel very taxed after you use this. And as I said, I caution you to take it easy for the first couple of weeks until your body gets assimilated with this. What else? I feel personally that whole body vibration offers an advantage because it's easier to use. And as I said, it gives you more energy versus depletes that. Have I said that a couple times? Via Diabetes Canada. And we're going to switch gears here. I'm just going to check in on questions before I get to my other tools. So last point, via Diabetes Canada. Almost anyone, whether they have diabetes or not, can benefit from regular exercise. I'm sure I am speaking to the choir right now. Well-known benefits of exercising. I don't like the word exercise. Let's use the word active. It's more motivating. Benefits are weight loss, stronger bones. Got to bear your weight to build your bones. This is just a way to do it. Improved blood pressure control, lower rates of heart disease and cancer, as well as increased energy levels. We knew that. Regular exercise has special advantages if you have diabetes. Regular physical activity improves your body's sensitivity to insulin and helps manage your blood sugar levels. So, there's two pieces of the pie with diabetes, just like anybody else out there. What we're putting into our bodies, is the fuel for the activities we wish to achieve. If we're not doing any activities and we're not putting any nutrient-dense fuel into our bodies, down the road, some of these symptoms might start presenting themselves, and that, start paying attention to those things. I outlined a few symptoms if you're just joining us at the beginning of the session. So before I move in, so whole body vibration, hands down, due to its versatility, it offers a very low impact, accelerated time. You don't have to spend as much time doing it. And it's a little fun. Using these machines can be fun. They make you feel good. They energize you. Your kids love them. Your mom and dad love them. So there's more you can do with it. But again, that's you and what you choose to do with it. So before I get into my other tools, thank you, lovely Lauren, behind the scenes. I just dropped a few links for those of you that do like the science. I just wanted to add some information. Patricia, should I be barefoot? Good question. Really depends on you. I have trained barefoot on these machines for 15 years. But with some of my diabetics, if you are dealing with neuropathy, if you just drop $500-600 on some new orthotics and you're dealing with structural issues, if you have sensitivities at all in your feet, you may want to use your shoes. Or if you've always been using your shoes, sometimes the shoes, your feet get lazy. They don't need to do their job because there's a shoe with an arch, and they just have to sort of hang out, if you will. So part of good gait, good balance is starting at the foundation of the house that is your body. So I would recommend, Patricia, if you normally try your plate barefooted, grab one of your mats, grab your mat and put it on the machine. This is just super thick. That's my mat. But you get them out with your machine. I would recommend putting it on the surface. Try barefoot or socks if you prefer. You're going to notice it's probably going to feel a little stronger. The shoes, to a degree, do absorb a bit of the energy and sort of stabilize you a bit, and maybe bring your feet a little bit closer than you have been to compensate for that. If you're doing anything fitness related, it may be different, but if you're just using your machine for feel good use, you really don't need to be wider than hip width apart. It's not functional. You might feel that you're shaking your fat around and getting more benefit, but that's really, you don't walk across the floor with your feet wider than your hips. You might have some alignment issues after time. So it's, if you are standing wider than your hips, push yourself a little bit. Don't make the machine do all the work. Try squatting a little bit. Fire up those leg muscles. Help from the sitting, the rest of your body get better blood flow, improve the bones, the strength. That's how you progress. And we've done lots of videos on this page on that. So we'll talk about squats another day, but it's about progressing and becoming better so that you don't have to, progress downhill. This, as I said, is not a life sentence. So there's a few things I've had Laura drop in the links here. Patricia says she just received her Lifepro for Mother's Day. So please, if you haven't really got started using it yet, know that you can use it more than once per day. But if it's just for feel good stuff, keep it that way. 2 to 5 minutes here and there. If you're doing a workout, that's a little bit different. If you're asking me how long I need to work out, you need to learn how to work out. What is a workout? What are the squats and the lunges? It's about your goals and the body that you're dealing with. So it's going to vary a little bit for everybody. I check out your VIP page for all the videos that have been done here, and check out your training site as well. There's lots of good tools available to you. They're not just awesome stuff. They're awesome resources and tools. And, we're giving you everything we can to try to help you be successful here. But sometimes it takes you a bit of time to find what your fix is. What works for me and what I enjoy using might be very different for you. It's the consistency of using whatever you decide works for you regularly is going to give you the benefits long term. So I need a little bit of Java. Okay, so I want to move on to some of my next favorite tools. This is a foot massager. And I know it's not the second on my list, but because it was closest, I'm going to grab it first. I've had Lauren drop my favorite tools, but one of the big things I talked about earlier, when you are dealing with diabetes, severe diabetes, it's the neuropathy, it's the feet, it's standing on those feet. So instead of just sitting in your chair, a vibration plate, as I showed you, can be done. But if you know that you're not going to do more, you just want something to massage your feet, or you want something in complement, maybe under your desk or in the kitchen to go in unison instead of hauling your vibration plate around, I really recommend checking out one of Lifepro's foot massagers. They've got a number of different ones, and just like a vibration machine, you're going to have your own preferences as far as how it operates, what you like, what you don't like, based on your own sensitivities. I've got a couple of different ones, and the one that I wanted to show you today, too funny, I spent half an hour looking for it this morning, and I'm like, where's the Vibra Carrot? Where's my Vibra Carrot? Last weekend, my Uncle Don was here, and he's got pretty severe diabetes, and he's got pretty severe neuropathy in his feet. And I've been the crazy niece for years and years. He doesn't like the vibration machines. He's a hard-working guy. He has no desire to work out. It's just not his thing. And I was telling him about my Vibra Carrot. It's just a buzz tickle. I like it because you can use it in two situations where you can put your feet on it while you're on the couch, or you can actually flip it over. There's 2 sets of feet on it, and it'll massage the back of your calves. So sometimes if that neuropathy has progressed, you're going to see it traveling up in through the thighs or into the calves, and in some cases into the other extremities. We're talking diabetes today. I've been rambling a little bit, and I thank Patricia's for her comments. But if you have any questions, or if you do deal with diabetes and you've got some of your own hacks that you'd like to add on today, please feel free to drop a comment. But most of Lifepro's foot massagers are not super huge. This is a really light version. It does move as well as there's little kind of, it's hard to see because this thing's all black, but in here there's like these little shiatsu knuckles. So, certainly I find I have fatigue and aches and pains not in my entire foot, but there's certain parts at the end of the night that I like to get to. And I find with a lot of my clients with their neuropathy, it's worse on the toes or it's on the heel, or there's usually one area of the foot that it kind of rooted at or started at. So this model, I really like the fact that these little shiatsu, you can kind of target those little areas. On the Vibra Carrot, on the top of it, there's like a big foam dense strip, and you can get into the undersides of your toes and the arch of your feet. So you can kind of spot treat or do the whole foot at the same time. So back to my uncle Don. So he took it home. We had a big family barbecue for my husband's birthday a couple weekends ago, and he's like, well, he might like to try that foot massager. So I said, okay, yeah, put it. Like, he never is willing to try anything. So I told my husband, get it in the car right now. And it's not coming back. It's not coming back from Uncle Don's house. I completely forgot. He literally called me 2 days after, and he said to me, he goes, so, I kind of like it. How much can I use it? And when people ask me that question right after they've gotten one of these toys, I know he's been using it lots and lots. And I said, well, how often have you been using it? 5-6 hours a day. So he's been, in my opinion, overdoing it, and he was a little bit inflamed and a little bit puffy, but he kind of had this big swell and then a big deflate, and he's got a lot of sensitivity back now. And one thing that I do caution, because you're going to get very quick relief with some of these tools, probably within the course of the session, don't keep going longer and longer thinking that 20 years of developing this deficiency is going to be fixed in a 10-minute session in front of the TV. Be kind to your body, keep it hydrated, give it the things it needs to sustain and progress positively forward when you're adding these tools into your routine. So foot massager of any kind, if you have diabetes, is my number 2 to the vibration machine. And it might even be your number 1. Like I said, if you're the type of person that's, you're not going to do more with the vibration machine and you just want to treat the feet, or you just want to, do something after you've done the gym, I think a foot massager, not only because they're a little more portable and mobile, they do add some nice ergonomic under your seated station, but it's more singular purpose. So, this is specifically what you're looking to treat. I'd recommend looking at any of the foot massagers that Lifepro offers. So, my number 2, even though I jumped forward to number 3, is a massage gun. Massage gun, vibration. Everything's about vibration. And, these are all just different ways to use vibration to heal the body. What you like and what's going to work best for you is going to vary based on your preferences and your pain levels and so forth. If mobility is horrible, super poor, you're not going to walk across the floor to even get on your vibration machine, or you left your foot massager in the other room and you're just dying, a massage gun is probably the number 1 universal for all conditions, but especially for neuropathy, arthritis, pain, swelling, a lot of the things. First link to Harold doesn't work. Oh, I might have to check that after the fact, Patricia. But sorry, with a massage gun, this is going to target really anywhere that you need it to. So if you notice your symptoms are progressing in your feet and you're at the office, boop, pull this out of your bag or your desk drawer, and you could do a spot treatment on your foot while you're at the office. If you have swelling, perhaps in certain areas, or if you have aches and pains, the only place I wouldn't recommend using a vibration gun if you're dealing with severe neuropathy through diabetes is if you do have any open sores. You don't really want to massage open sore areas. Now, if you're finding it's itchy or things are, certainly you could massage around the area, but be very cognizant not to hit any open wounds or sore spots with your gun, especially if you're a new user. Literally, guys, I'm going to tell you, if you're lacking hand strength, if you have any kind of carpal tunnel, any of those issues associated, just holding on to your massage gun regularly is going to strengthen your hands. Not kidding. It's probably the number 1 sort of long-term feedback I get from some of my gals using these for their pain. A lot of times with these tools, the reason you fall in love with it was never the reason you pursued it. It's something else happened that you weren't even expected. It's just like Christmas. So just by hanging on to this, you'll feel vibration in through the hands, the wrists, even up here, do little circles in the air. This is going to increase your circulation. This is going to fight your neuropathy just by hanging on to it. They're not very loud. You're not going to bug anybody at the office. So, you know, or hold it with both hands. So put one up on the upper arm part and one here, right? Love mine. And, you know, get creative. Like I say, it could be the feet, it could be the legs, wherever you're dealing with sensitivity issues or swelling. This is a perfect little thing that can really go with you anywhere, be on the bedside table, in the kitchen. Have these tools available and just be mindful. I think one of the big things with diabetes, I have so many in my family dealing. My stepmom, Helen, she puts in the time. She does the work. She's got a vibration machine. She's got it in her living room. She's got the mini. So she starts with her feet on it. And then once she sort of warms her legs up, and she's been using one for quite some time, she progresses to a little bit of standing. She knows that the importance of keeping her bones and leg strength is critical as well. And a lot of times when you're dealing with diabetes, it's not just diabetes. You might have other issues, high blood pressure, you know, heart issues. So a lot of the things that I talk about, maybe today it's good for diabetes, but it's not like you have to do a whole lot of different moves to improve your Parkinson's or your, you know, bone strength. You know, a lot of it is just simple weight bearing exercises done regularly is all your body's looking for. Whether your body presents deficiencies or poor lifestyle in the form of diabetes or Parkinson's, you know, don't let it get to that point. Okay. So this is my number 2. The foot was my number 3. Let's move to my number 4. While we're talking hands, the Legra. This is kind of my favorite for every condition, but what I like about the Legra, it's also use specific, like the foot massager. If you're dealing with severe neuropathy and you can't get down on the ground to apply your hands directly to your foot massager or your vibration machine, this is your best friend. So just like the foot massager, if it's your hands that are giving you grief and you know you're just going to do your hands, absolutely recommend minimal investment in the Legra. You can see sort of right through this if you've never seen this product. There's a number of controls on here. This is a lithium charge. So it's compression. We're going to get into some other compression because compression is good for diabetes. But for the hands, whether you like heat, what kind of intensity level, there's several different programs. You can set this manually. You can use this sitting at your desk. Just put your hand in it. Once it's inflated, it doesn't come off your hand. You know, really, again, whenever symptoms present themselves, have your tools available and treat them. Don't leave it till later in the day when you've left things so long that you're going to have a poopy sleep tonight because you didn't do anything about your aches and pains. Use these and have them available as part of your self-care. And I guarantee you, if you start using these things regularly, you're not going to need to use them as often. Keep using them, but you know, if you're using things 3 to 4 times a week regularly to treat symptoms, after about a month or 2, you probably won't need to use them as long or as often to get the same effects. Because guess what? You're starting to improve things. And eventually we get over to this piece called maintenance instead of having to do all the work. So it will get better. Do what little you can while you can and just be consistent. Do a little bit every day for you. Okay. So this is my number 4 and they're all kind of tied. But this is hand specific. I absolutely completely recommend it. Last but not least, anything compression. So Lifepro has 3 types of compressions. They've got the Cryo Frost, which is cooling gel packs that through air compression inflate and deflate and massage you wonderfully and very comfortably. And they're very adjustable, so you can do whatever is most comfortable for you. This is the Radiate. So this is just, I've got 2 sets of legs. These are just the feet and the calves. They also have a full set, which are the feet, the calves, and the thighs. Really depends on you. These ones I'm showing you because these are the ones, believe it or not, sometimes it's not always the biggest and the fanciest. Metaphysics lover. You know what? I will repost the links individually later, guys. Thank you for checking that as well. So I know it. I probably just didn't type it in right when I sent it to Lauren, so it's probably a typo on my part. But these will go on your foot as such. They're all Velcro, So you can attach, everybody's got a different size and sensitivity. I recommend leaving them loose so you can sort of slide them on and off. And what you'll find is they compress. So these also, I'm looking for the remote here. These also have a lithium chargeable battery. These are awesome in the car on the way to appointments. If you do lots of long road trips, it can be a nightmare on the plane or in the car if you're dealing with neuropathy or swelling or anything below the legs. And as I said with the vibration plate, you just want to get circulation moving. You want lymph to get moving. You want oxygen to be dispersed throughout your system. So something like this where it's portable and you can just hook it up in the car is a no-brainer. I like the littler set because I do like doing my feet and my calves. Many of my clients have the full legs. It really depends on where you're using it. If you have poor mobility and very, very poor hand strength, you may find some of the larger sets a little bit cumbersome to start out, but use your vibration plate and your other tools and your hands will get stronger. So these connect very, very easily. I'm trying to get the light in here so you can see. If you do not connect these the right way, they won't turn on. Just telling you now, one is marked left, one is marked right. So if they're not in their appropriate spots, they're not going to connect. So 1 and 2. And then on this one, as I said, there's a bunch of different programs. You can sort of get started depending on what you feel your tolerance is. And I would recommend, if you've never used compression before, okay, sort of shows you what, it's not very loud. I just want you to hear how quiet this thing is. You probably can't even hear it over here. So you're not disturbing anyone if you want to use them in bed even and get some of that blood flowing. If you've got restless leg or you find a lot of your symptoms are presenting themselves at night because you spend a lot of time on your feet maybe throughout the day, use some of these tools wherever you can be lazy. Lay couch, give your body a chance to get that blood moving uphill, and you'll see these things just inflate. So they expand and contract, expand and contract. And if you've got them on too tight or they're painful or you're really, really scared, you can just hit power and they literally, it completely stops immediately. So you don't have to worry. You can slide them out, take the Velcro off. You'll notice the Velcro when it's brand new, it's pretty robust. But after you've used it a couple of times, I think you'll find you're probably not adjusting the Velcro as much as you'd think. You kind of get your fit, and like me, you'll find that you just sort of slide them on. And then as they compress, you don't want them skin tight when you're putting them on. So if they're not baggy and loose, but if you can slide them on comfortably like a big winter boot or something, you'll probably find it's just about the right amount to start. If from there you like more intensity, that's completely up to you. If you find it's too intense, loosen them up a little bit from there and you'll be set. Again, if you don't connect this in the right spot, I always bring that up because it's funny when I'm using it myself, I don't think about it and oh, it's not working. So I always try to be mindful in the sessions. So again, this comes with a carrying case. So there's really no reason to not take it with you on the go. This is also a really nice tool at the office if you do spend a lot of time seated. These are amazing just under the desk. You can slip your shoes off, get a little blood flow going. As I said, if you spend a lot of time traveling, commuting, you're on the bus, you're on the plane, you're on the car, there's lots of little ideas that you can incorporate. Don't suffer. If you're just sitting there, you may as well do some self-care. I think that almost rhymes. I have the Rumblex Plus. What number did you use on yours? Patricia, it's absolutely not a specific number or level for a symptom. There's different ranges depending on what movement style you're using. I usually recommend when you're starting out a closer foot placement. That's how intense you are moving, and a mid to high speed. Don't think like a treadmill. This is just my personal opinion. It's like, what's the best speed to run at on a treadmill? It depends on you. And do you like fast? Do you like slow? Can you take the impact? So on a vibration plate, the really slow speeds are really wobbly and we feel everything shaking. They're about balance and stability. They're kind of like a Bosu ball. So if you are dealing with hypermobility, poor joints, pain, I think you'll find the mid to higher speeds more tolerable, coupled with a closer foot position. So it's not about standing as wide as humanly possible. You're not getting more benefit. You're just getting more impact, and how much impact you can tolerate. If you got to lock your legs and stick it, you're standing too wide. Think functional, keep those feet in line with those hips, and progress in depth and make your positions more challenging versus just going wider or faster and think that the machine's going to do all the work. So try that out, Patricia, and see how you do as a sensation and how that feels. Yes, my hips hurt the first day. Everybody overdoes it, and it's going to sound silly, Patricia, but I love that your hips hurt the first day, not because your hips hurt, but I know that you tried. You got off your butt, you got it out of the box, and you did it. There's nothing more deflating than, me following up with some of my clients and saying, so how's it going? I don't know. I haven't taken it out of the box yet. So if you've overdone it, that tells me you tried, and you've learned your lesson. If you are dealing with fatigue or pain, however you might feel when you overdo other things, if you're walking too much, if you did too much time at the pool, however over exercise feels on your body is going to be very similar on a vibration plate. It's just going to happen a little quicker because, as I said, it's kind of like a little time machine. Not only does it reduce the amount of impact over traditional exercises, but you get a little bit more action in less time. So I think for two reasons, it's kinder on our bodies, not only because you're spending less time, but because we're spending less time, there's less effort and strain on the muscles and the joints. And, this might just be that page turner for some of you that have struggled with activity. What else can I tell you? Lifepro Fitness, thank you so much. She fixed the links. Lauren, you're the bomb. So poor Lauren, about 10 minutes before live, there are literally, and please don't go surfing science, and don't even think the best research studies out there give you the perfect protocol. There's a lot of different options in vibration machines between, how far apart are your feet and what speed are you using and what position are you doing. So there's more variables than will ever be validated. Think of the machine as an environment. It's an environment that makes whatever you might be doing on the floor more effective, less strenuous, and in less time. So if you've been turned off of exercise or activity because it just takes too much out of you, or you just don't like it, even just getting a little bit of movement through some of these tools today are probably going to propel you to at least start managing symptoms and start having a better quality of life. But maybe if you start moving and feeling better, you might progress to other things. So I'm going to stop rambling, and I want to see, I don't have all the answers all the time, but if anyone has questions, I would invite you to give me your questions now. And if you do not, and you're watching the recorded version of this, please feel free, if you have a vibration plate, you're dealing with severe symptoms, and perhaps you had a poor experience, or you're afraid of using the machine because somebody else told you they had a bad experience. Nobody else is you. And sometimes one of the most amazing things about social media is there's all these tools and all these resources to help us, but sometimes it's overwhelming. You walk into a gym, and I tell this story many times, you and whoever's on my live here today, we go to our local gym, and we say we all want a better program to help improve our diabetes. If we talk to 5 different trainers, we're going to get 5 different programs based on what they think is best and what equipment that gym happens to use and promote. So there's no best way to improve your diabetes as far as an activity. The best way to improve your diabetes is simply to start becoming active. And what Lifepro offers you is just a wide range of can-do, easy-to-do tools to cater to whatever your mobility, whatever conditions you might be dealing with, the symptoms that come with those, and whatever your motivation level is. I like to work out. A lot of times working out is just moving things around or putting things in my garden. But if I physically was unable to dig in the dirt and do some of the things, it's always a much bigger hill to climb than if we just put a little bit of effort in now. So if you are dealing with some preliminary stuff, or if you're on the opposite end of the spectrum where symptoms have progressed to the point, please do not lose hope. In my time, and I'm going to get in trouble for a few doctors, but I swear I have had clients reverse their diabetes, or they swear that they've reversed their diabetes. Perhaps anything's possible if we're giving, this vessel nutrient dense foods, a moderate level of activity and just a little bit less stress and maybe a little bit of breathing once in a while. But you never know what's possible until it's possible. So please don't give up hope. And if you do have these tools at home and you're not using them, I hope I've given you some simple ideas to help motivate you, get you motivated again to use use them. You bought them for a reason. Don't give up on yourself. And if you haven't seen results right off the bat, or you're not seeing what you wanted to see within the first week, it took you way more than a week to get to the situation that you are in if you're dealing with this condition. So be patient, be kind to yourself, and be consistent with what you apply. That's going to be the best recipe in the long run. Okay. Thank you. Yes, your hips hurt the face first day, Patricia. I really hope that you bring those a little closer and keep me posted on that one. Come back and do a comment on that. Let me know if the closer feet and faster felt better. I almost guarantee you it will. And to everybody else that joined us today or are watching this later on, thank you so much. If you've got someone with diabetes, if you suspect you might be dealing with diabetes, there's so many things that you can do today that are affordable and accessible to you through Lifepro. Thank you for listening to me ramble today. As I said, if you have any questions, please post those in the live and I will get to those accordingly. And tag me so I know that you've made a comment. Everybody have a great rest of your Monday, and I will see you next week. I know for something medical related, I think it's World MS Day. But here's the thing: Monday is a holiday for my friends of you in the States. Yes, closer feet and faster helped a lot. Awesome, Patricia, you're a good student. See, she listened. Thank you. Next Monday is a holiday for you folks in the States. It's our holiday here today in Canada. So I will see you next Tuesday, May the 30th, for World MS Day. I've done a session on MS before. There's going to be other things coming up, but we're going to talk about some of the exercises you can do for MS, some of my favorite tools to combat the symptoms of MS. So please come with your questions on Tuesday next week at 6:30 Eastern Standard Time. As always, thank you, Deb. You're a master teacher, and I benefit so much. I'm a master talker. That's for sure. That's for sure. About the rest of it, it's all subjective, but I do appreciate the positive feedback. And, who knew that all this time that I spent shaking away on these machines would benefit the greater good someday. So thank you for listening. Share this with your friends that do have diabetes, and there is help out there. It's up to you to get started. Thanks so much, guys. Have a